Whether you're gearing up for your licensing and certification exams, or you just enjoy learning about counseling topics, you're in the right place. Welcome to 12 Core Functions of Counselors. I'm Letitia, and today we're breaking down the 12 essential tasks counselors do in our field. In this study presentation, we're going to walk through each of the 12 core functions step by step. I'll explain what each one means, give you real-world examples, and show you how they are applied in the counseling setting. There's also a short case study and a quiz at the end so you can test yourself. So what exactly are the core functions? They're basically the main tasks and responsibilities counselors do, especially in substance use and behavior health. It's like your counseling job checklist from the first phone call to discharge when a client is transitioning out of services. These functions make sure the client gets quality care every step of the way. The first core function of a counselor is screening. It's how we decide if a client is the right fit for our services. You might ask some key questions about their needs and their history. If they're a good fit, you move forward. If not, you help them find another provider by linking or helping them coordinate care somewhere else. The second core function is intake. This is the paperwork part. You collect IDs, insurance info, sign consent forms, all the official stuff that gets the client fully admitted into your program. It's the formal start of services. Function 3 is orientation. This is when you introduce your client to the program. You go over the rules, expectations, their rights, and what they can expect. This is a great time to answer questions and ease any nerves they may have. Core function 4 is the assessment. This is where you ask about their background, struggles, strengths, and goals. You're trying to understand what kind of help they may need so you can build a solid plan. Treatment planning is when you and the client make a game plan together. It may include goals like staying sober for 30 days or attending weekly sessions. You break it down into steps they can follow. Core function 6 is counseling. This is the part where most people think of when they think of therapy. Counseling is where the real work happens, whether it's individual or group. You help the client explore feelings, develop skills, and make progress towards their goals. Core function 7 is case management. It's all about the life stuff. You might help your client apply for benefits, find housing, or connect them to resources. It supports the counseling process by making sure they're stable outside of the sessions. Crisis intervention is core function 8. If a client is in danger or struggling hard, you step in. You help them calm down, stay safe, decrease their risks, and get them connected to the right emergency services. Client education is where you teach your client something new that helps them grow. This might be about addiction, emotions, coping, or even self-care. The goal is to increase their understanding and confidence. Referral is knowing when you're not the right person for the job or there's a specialty that you cannot help the client with. If a client needs something you can't provide, like medication or a specific type of therapy, you send them to someone else who can help. Core function 11 is documenting and reporting. You've got to document everything: sessions, goals, progress, updates, and issues. Good notes protect you, support the client, and keeps everyone on the same page. And lastly, but not least, core function 12 is consultation. Sometimes you just need a second opinion. That's what consultation is for. You might talk to a supervisor, a colleague, a trusted professional about how to handle a tricky situation. It's about teamwork and better client care. Now that we've identified all 12 functions of a counselor, let's talk about why they're really a big deal. This isn't just a list to memorize for your exam. These functions are the foundation to our work. They give us structure and help guide what we do from the first client contact until discharge. They also help us stay ethical by clearly outlining our roles and responsibilities. The core functions ensure we're offering complete care, from assessment to treatment planning to aftercare. They also support accountability, helping us track client progress and document what we're working on. These functions create consistency across different counseling settings, which means clients receive quality care no matter where they go. Some functions even enhance client safety, like crisis intervention and assessment. And they improve communication with clients, families, and treatment teams. Most importantly, if you're preparing for a certification exam, knowing these core functions is key to passing. Learn them, understand them, and use them. Now it's time for our brief case study. During our time studying together, we'll use case studies and made-up scenarios to reinforce what we've learned. This case study is about Alex. He's 19, balancing work, school, and family, and he's here for counseling after a minor possession charge. We'll read the scenario first, then we'll test your clinical thinking with a few questions along the way. You can grab your pen and paper or just read along. Alex is a 19-year-old who is referred to your outpatient counseling program after receiving a minor possession charge for marijuana. Alex is unsure about counseling but shows up for the intake appointment. During your first meeting, Alex shares that he has been feeling stressed about balancing work, school, and family expectations. He admits to occasionally using marijuana to take the edge off, but denies any heavy use. You complete a screening and determine that your program is a good fit for Alex and his needs. Together, you create a treatment plan focusing on stress management, coping skills, and substance use education. As sessions continue, Alex opens up about relationship stress and shares that his employer recently gave him a warning about tardiness. During one session, Alex reports feeling overwhelmed and admits he used marijuana again after an argument with his partner. Each of the questions on this quiz is based on something a counselor actually does. As we go through them, think critically, not just what sounds good, but what specifically matches the core function described. We'll walk through each answer together, and I'll explain the correct answer and also explain why the incorrect answers don't fit. Question 1. Which core function is demonstrated when the counselor determines if Alex is appropriate for the program? A. Intake. B. Screening. C. Assessment. D. Case management. The correct answer is B. Screening. Screening helps us figure out if we're in the right place for Alex. Intake comes after that, and the assessment part of the interaction dives a little bit deeper. Understanding what part of the service timeline each core function happens will help you on your exams when eliminating right and wrong answers. Question 2. When the counselor works with Alex to develop goals for managing stress and substance use, this reflects which core function? Counseling, client education, treatment planning, or consultation? The correct answer is C, treatment planning. When Alex and the counselor set goals for stress and substance use, they are planning his treatment and setting goals specifically for him and his needs. It would not be A, because counseling happens when you actively help the client when you're actually working on the goals. It would not be client education, because client education involves teaching skills and information. And it would not be consultation, but consultation is when you work with other professionals for support. The correct answer is C. They are treatment planning. Question 3. When the counselor teaches Alex about how stress can lead to substance use, which core function is being used? Client education, referral, reports and record keeping, or case management? The correct answer is A, client education. This is when the counselor shares information and teaches a skill. This is also called psychoeducation. It would not be B, referral, because referral involves connecting the client to another provider or a specialty. It will not be reports and record keeping, because that involves documentation, not necessarily teaching. And it wouldn't be case management, because case management specifically includes helping the client with external sources and connecting them to outside things that can help them. Question 4. Alex's employer warns him about his tardiness, and the counselor helps him problem solve this issue. Which core function applies? Case management, referral, counseling, or crisis intervention? The correct answer is C, counseling, because the interaction included emotional support, skill building, and helping the client manage life's challenges. Case management was incorrect because it will only apply if you were coordinating care with the employer directly. Referral was incorrect because a referral isn't needed in that moment. You were working directly with the client. And it wasn't crisis intervention because Alex was not in immediate danger to himself or someone else. Question 5. If Alex relapses and uses marijuana again and the counselor offers support to stabilize him, which core function is that? Crisis intervention, assessment, referral, or client education? The correct answer is A, crisis intervention. This happens when there's an immediate emotional or behavior concern like relapse. Assessment would be incorrect because that is information gathering at the beginning of the interaction with the client. Referral would be inaccurate because that involves sending the client or linking the client to another provider. And it would not be client education because client education involves teaching about a specific topic. It may be involved after. However, the specific idea of helping the client when there's a major change that may threaten the well-being is crisis intervention. The 12 core functions of a counselor are the backbone of effective treatment. They guide everything we do from start to finish, making sure we're ethical, organized, and client-focused. Let's quickly review all 12 functions. Screening. This is where we check to see if the client is a good fit for our services. Intake. This is where we gather important information and background information on the client. Orientation. This is the part where we explain how treatment works and what the client can expect, like rules and time frames. Assessment. This is where we ask all the questions and dig deeper to understand the client's needs, challenges, and strengths. Treatment planning. Together with the client, we set clear goals and make a roadmap for their success. Counseling. This is where we meet regularly, provide support, and help clients build skills and insight. Case management. This is where we connect clients with other services and supports they may need. Crisis intervention is when there's an emergency, we step in to provide immediate help. Client education. This is where we teach clients about mental health, coping, and many other topics. Referral. If clients need help outside of what we can do, we connect them to the right resources. Reports and record keeping. This is where we document everything that's happening to track progress and ensure accountability. And consultation with other professionals. This is where we work together with other professionals in our field to make sure the client gets well-rounded care. These functions aren't just tasks. They help ensure our clients get the best care possible. Being able to successfully identify and understand the importance of each function is also vital to passing your examinations and licensing tests.